How much of a role did Obamacare play in our current medical state in this country?
Huge. I still remember when I graduated from medical school, I paid for my own private health insurance. I paid about $1,000 a year because I was in good health. I didn't need the group subsidized policy from the medical school, which was 2 or 3 times more. As soon as I got out back to California, returning from the Midwest, I had to go and buy Obamacare, or called Covered California, because that's when the competitive market disappeared for insurance. My premiums went up 300% in the first year. I started paying $200 or $300 per month. This was about 12, 15 years ago. Now it's up to $600 a month. Why? Because it's not insurance, it's a subsidy. As a man in California, I legally cannot buy an Obamacare policy that does not provide obstetric coverage. As a man without children, I cannot buy a policy that doesn't offer pediatric care. That started about a decade ago. That was the beginning of the end of actual insurance. Now we're just simply subsidizing other people's medical problems and personal life choices. No judgment against children. I love children. No judgment against women getting pregnant. Love pregnant women. We need more kids. But why should I have to pay for other people's children and other people's deliveries? It should be the individual who makes that choice that assumes the financial cost, not society.
Can this damage be reversed? It sounds so monumental and scary, and it sounds like something that can't be overcome, but you're in the industry, I'm not. Can it?
Couple things. I think we need to file lawsuits. Harmeet Dillon is representing a poor girl, I think she's 18, 19 years old, named Chloe Cole, who had her breasts removed when she was, I believe, 12, 13 years old at a Kaiser in Oakland. After 70 minutes of so-called counseling from a woman counselor, and then had her breast cut off by a woman doctor, a woman surgeon, and a woman clinic director. The damage that's being done to the United States today is disproportionately being caused by women. It's horrific. She's now suing, rightly so, because she will no longer be able to breastfeed if she decides to have children. If she can have children, she may be infertile. She's one of several lawsuits being filed against that Kaiser. If we can bankrupt the individual doctors and the clinics who are malpracticing their patients, who are harming them with multi-million-dollar settlements, this practice will end. Second, the government can step in. The government can deconsolidate all of the medical care practices. Right now, the biggest problems we're having is that everything is being consolidated into corporate environments. Kaiser, example, Cedars-Sinai, UCLA, all these healthcare institutions, they're forcing doctors to make unethical choices at the risk of being fired if they don't comply. Private care medicine is the only way to go right now. If you want to get a good doctor, you need to find a doctor who's an independent practice, meaning independent from big pharma, corporations, media, politics. Doesn't mean he's going to be good, but it means you have a shot. You can't get good medical care. You can't find good doctors anymore at the large corporate practices or the large academic institutions. They're all caught up with government payoffs, big pharma. They don't follow ethical standards. It's all big consolidation of power, and that always leads to bad things. Bigger is almost always worse.